I'm Marcellina Mian, pediatrician, Associate Dean for Medical Education at Weill Cornell Medicine. So ordinary crying is, infants cry when they're hungry, when they're wet, when they're maybe too hot or too cold, and that's not something that a parent needs to be particularly concerned about. If crying is accompanied by a fever, there may or may not be other symptoms. If the child has a cold or a flu, there may not be any symptoms other than perhaps a runny nose. There may be some specific symptoms. For example, if the child is pulling at his or her ears, that may be the sign of an ear infection. If the child is having difficulty eating or swallowing, for example, give the infant a bottle and the child starts to suck and then starts to cry, that might indicate either a sore throat or an infection in the mouth. And it's worthwhile looking in the mouth to see if there are any signs of a rash or that sort of thing. There may be vomiting or diarrhea, which would indicate that the child is having some abdominal pain or discomfort in the abdomen. There's one particularly serious form which may not be accompanied by fever, which we call intussusception, and that's because the intestine is like a tube, and with intussusception, the part that's higher up gets into the lower part, so it telescopes in, and that causes an obstruction, and that can be very serious. And the symptoms are intermittent crying, with the child suddenly drawing up his knees up to his abdomen, and then the crisis passes and the child calms down. So this intermittent crying, which after some time may result in some jelly-like bloody stool, and happens in infants between 6 to 36 months. Important to keep an eye on that, but it's fortunately not a common condition. Another serious symptom associated or condition associated with fever is infection of the brain or the membranes that surround it, so encephalitis or meningitis. And with infections of the central nervous system, the kind of crying that infants do is often very high-pitched or shrill, so it's a different cry from the usual, and parents should be aware of that and pay attention to that. I also want to mention that with the vomiting and diarrhea, there may be dehydration. So in addition to the crying, the parents need to pay attention to if the child is hydrated. So make sure that the child gets more fluids in than fluids go out. And if the child starts to have less tears or urinating less often, that's a sign that dehydration may be setting in and that the child should be seen. An important aspect when a child is crying and ill with a fever is to sort of check if the child is looking sick. Now, for any parent, any child with a fever looks sick. But what I mean is a child may have a fever and still be smiling or eating or interacting, playing, perhaps at times still whiny and fussy, but basically looking okay, looking pink and in pretty good shape. But if a child is just lying there or starting to look blue or gray, that's a child who's really sick and really needs to be looked at. What I think is important is for children to grow up to be the best people they can be. So to have a happy, healthy, and safe childhood.